Relaxed? Good. Let's get started. VHI Healthcare want you to be the first to hear the latest thinking about mindfulness in the workplace and what your employees are looking for in workplace wellness programs. We've carried out an in-depth study with leading mindfulness experts as well as employees in Ireland and uncovered some valuable insights. While there's a lot of confusion about mindfulness, it's clear that many Irish companies are now starting to take it seriously. In fact, 3 out of 4 employees would be open to attending a mindfulness course. You can discover more insights in our full research report. So, how are you feeling right now? Since you're listening, why not try some mindfulness yourself? Here's a mindfulness expert to take you through some simple exercises.
Hello, my name is Josephine Lynch and I'm a mindfulness teacher. You're about to participate in 2 mindfulness practices, a short one of a few minutes, followed by a longer body scan of about 30. And so if you're sitting, simply know that you're sitting and maybe adopt a sense of being upright. Or if you're standing or even walking, just getting a sense of being in your body as best you can. So pause and connect. A very short way to check in what's happening right now for us. Step 1 is just becoming aware of what's happening. Awareness of what thoughts are going through the mind. And as best you can, just acknowledging thoughts as mental events. Perhaps even putting them into words like planning or ruminating. And so what feelings are here? Maybe turning towards any sense of discomfort or pleasantness or unpleasantness and acknowledging them as best you can. And then what body sensations are here right now? Perhaps quickly scanning the body to pick up on any sensations of tightness or bracing or holding, and acknowledging these sensations because they're already here. And giving ourselves a moment or two to tune in. And now step 2, gathering and redirecting your attention to focus on the physical sensations of the breathing itself. Maybe even putting a hand on the abdomen if that's possible. And sensing the flow of the breath in the abdomen, the gentle rising, the abdominal wall expanding as the breath comes in, and the falling back as the breath goes out. Following the breath all the way in and all the way out. And maybe using this breathing as an anchor to anchor yourself into the present. And now when you're ready, expanding the field of your awareness around the breathing so that it can include a sense of the body as a whole, the entire body, the posture, the facial expression, the feet on the floor maybe. And if you become aware of any sensations of discomfort, tension, holding, taking your awareness there by breathing into them on the in-breath. And then maybe breathing out from these sensations, softening and opening with the out-breath. And then perhaps, as best you can, bringing this expanded awareness to the next moments of your day. The second guided mindfulness practice is the body scan. Welcome to the body scan. Mindfulness is the art of being in the present, in the here and the now, without the judgments we often bring to our experiences. Much of the time we are preoccupied, sometimes with thoughts about the past, or we may be worrying about the future. With mindfulness practice, we bring our attention to the present moment, to where we are now. All that is required for you to do in this practice is to allow yourself to be with your own experience. It is very helpful to try not to have many expectations, even of becoming relaxed. This may or may not happen. The most important thing about this time you are spending with yourself is to simply allow yourself to be with yourself, however you are, without judgments or expectations. For many of us, this will be a different approach towards ourselves. As often we are critical about the way we do things, judgmental about the feelings we have, or we have an idea about how things should be. Each time you put time aside to spend with yourself doing this practice, remember that you are playing an active role in improving your own health and well-being. The more acceptance we bring towards ourselves and our experiences, however uncomfortable that may be, the less stress our body-mind experiences. Throughout this body scan, it is very important to be gentle with yourself, not forcing or striving for anything to happen. Arrange to be in a warm and protected place where you will not be disturbed or interrupted. It's important to wear loose clothing so that your breathing is unrestricted and can flow. There is no right or wrong way to feel. There is no need to feel anxious or worried about doing this body scan properly. However you are feeling now is fine. It is just how you are feeling. For the next 30 minutes or so, you are not trying to create a particular experience. You are simply spending time being with yourself with an open and accepting attitude. Now find a comfortable position, perhaps lying down on your back on a mat or carpet, or sitting in a chair if that is more comfortable. Arms by your sides, legs stretched out and ankles uncrossed, with your feet falling gently away. The most important thing about this practice is your intention. Your intention to be present to yourself as best you can. If I suggest anything to you that does not feel comfortable for you to do, please feel free to do what feels right for you. You will find your mind wandering many, many times, This is perfectly normal. It is what the mind likes to do. Remember, we are not trying to control our thoughts or get rid of them. The mindfulness we are developing is to become aware of when our mind goes elsewhere, away from where we want to place our attention this moment. As soon as you notice that you are thinking, gently note this fact, and staying there for a few moments, befriending the thoughts or the feelings that are there. And then when you are ready, gently, with patience, returning your attention to the current focus of attention. And now noticing that you are breathing freely without trying to control your breath. Becoming aware of the in-breath and the out-breath. Perhaps noticing where the breath is entering your body, maybe at your nostrils or mouth. Or perhaps noticing how your breath is moving in your body, perhaps at your abdomen or belly. And if you like, placing your hands there to feel this physical movement, this rising and falling. Breathing freely without trying to improve it, make it longer or deeper, without trying to have the perfect breath. Trusting that your body knows how to breathe. And perhaps seeing your breath as a stable and a safe place, much like an anchor. Somewhere you can come back to whenever you want to touch base. Letting the breath breathe itself. Noticing the natural in and out that happens without any effort. And now letting go of this awareness of the breath. Remember that you can return to it at any time if feelings or sensations become too strong. And now removing your hands from your abdomen. They've been there. And then turning your attention to your body. Down the left leg, down to your left foot, down into your big toe, and then slowly to all your other toes, exploring your toes on your left foot. Exploring each toe one at a time. How are your toes right now? Noticing anything about your left toes. Any heat, any cold. Perhaps noticing the sensations of the air or a sock against your skin. Perhaps becoming aware of the nails and the space between the toes. Just becoming interested in your left toes at this moment. And any sensations that may be here, or none, and accepting that as your experience. Remember, we are not looking for any special experience. We are simply being with our sensations as they are, without striving for anything better. And if you are not aware of any sensations, accepting that as your experience. And then when you are ready, letting go of the awareness of your toes and moving your awareness to the sole of your left foot. Being curious about the sole of your left foot. Noticing the skin, the temperature, and maybe the pressure of the heel on the floor. And now leaving the sole of your left foot and moving your awareness to the top of your left foot. Noticing all the bones, the tendons that make up this part of your body. Being curious and interested in the top of your left foot. And accepting any sensations you may have here, or no sensations, that is your experience. And now moving up to your left ankle, to the inside of your ankle and the outside of your left ankle. How is your left ankle right now? Being interested in your left ankle. And just noticing any sensations that may be here. And now leaving your left ankle and moving your awareness to your left calf and shin. And perhaps noticing tightness or looseness, or the sensation of your calf muscle in contact with the floor. And now moving up to your left knee. This left knee at this moment, and the joint of your left knee. How is this area of your body? And noticing any sensations that may be here. Perhaps even strong sensations. And developing a friendliness to whatever your experience is. And now leaving your left knee and moving up to your left thigh. The inside and the outside of your left thigh. And the back of your thigh in contact with the floor. And just noticing how this left thigh connects to your knee and also to your hip. And becoming aware of any sensations that may be here, or no sensations if that is your experience, and allowing your left thigh just to be as it is in this moment without trying to change anything. And now, if you feel like it, bringing a deliberate breath as you breathe in to your lungs, and allowing this in-breath to flow all the way down to your left leg and out through your left foot. And as you breathe out, allowing the breath to flow back up into your foot and up through your leg and out through your lungs. And again, breathing in through your lungs and allowing the breath to sweep all the way down your left leg and out through your left foot. And then as you breathe out, allowing it to come back into your foot and up through your leg and out through your lungs. And doing this a couple of times if that feels comfortable for you. And now moving your awareness to your right leg and all the way down to your right foot and down to your right toes. Down to your right big toe. And beginning to explore your right toes. How are these toes in this moment? And noticing anything about your right toes. Any cold, any heat. Perhaps noticing the sensations of the air or the sock against your skin. And perhaps becoming aware of the nails and the space between the toes. Just becoming interested in your right toes at this moment. And perhaps developing an acceptance and a friendliness towards your toes. And towards any sensations you may have here. Remember, we are not looking for anything special. We are simply developing a way of being with our sensations as they are, without striving for anything to be different. And then when you are ready, letting go of the awareness of your toes and moving your awareness to the sole of your right foot. And being curious about the sole of your right foot. Noticing the skin, the temperature, the heel. And just being with this part of your body. And now leaving the sole of your right foot and moving to the top of your right foot. Noticing this area, all the bones, the tendons, and bringing a curiosity and an interest to the top of your right foot right now. And bringing an acceptance to any sensations you may have here, or to no sensations if that is your experience. And now leaving your awareness of your right foot and bringing your attention to your right ankle, to the inside of your ankle. And now leaving your right ankle and moving your awareness to your right calf and shin. Perhaps noticing some tightness or looseness. Or perhaps the sensation of your calf muscle in contact with the floor. And now leaving your right calf and shin and moving up to your right knee. This right knee in this moment. Moving your attention around your knee, the front joint, the side and the soft back of your right knee. And developing a friendliness towards whatever your experience is. And now leaving your right knee and moving up to your right thigh, the inside, the front, the side and the back of your right thigh. And noticing how this thigh connects to your knee and also to your hip. Allowing your right thigh just to be as it is, without trying to change anything. And now once again, if you feel like it, bringing a deliberate in-breath down your right leg and out through your right foot. And as you breathe out, allowing the breath to flow back into your foot and up into your leg and out through your lungs. Much like a wave of breath, sweeping in, down your right leg and out through your right foot. And as you breathe out, coming back in through your right foot, up your right leg and out through your lungs. And taking a few of these deliberate breaths, if that feels comfortable. And now bringing your attention to the pelvis. This area, which is like a cradle, holds many of our internal organs in place. If at any time sensations become too strong, or feelings become too strong, remember it is always possible to come back to the awareness of your breathing and to the movement of the breath in your body. And now bringing your attention back to the pelvis. Bringing your curiosity and interest to this area of your body. And perhaps noticing sensations here of tension or tightness or strength. And if so, bringing a friendly acceptance to whatever you may become aware of. And now leaving this area and moving your awareness to your lower back. This is an area where many people store tension. When we come to an area of tension or of painful sensations, or when we experience difficult feelings, you know we have a choice about how to be with this. You can move your awareness back to your breathing, your anchor. Or you can decide to move up towards the sensation or difficult emotion, turning towards that difficulty and using your breath to bring your awareness up to the edge of the sensation. Not forcing yourself into it or through it. Just moving up to the edge. And using your in-breath to open towards this area, rather than perhaps being tense and anxious about the sensation. And on the out-breath, softening towards the edge. Not trying to get rid of the difficulty, but allowing yourself to be there and to experience it. Allowing it to be there without wanting to get rid of it, which is our automatic response to pain and discomfort. Allowing yourself to accept that it is there for this moment. This is a very different way of being with discomfort for many of us. And now leaving your lower back and moving your awareness along the spine to the middle area of your back. How is this area, the middle back? Are you aware of any sensations here? And now moving the spotlight up to your upper back. This area where the scapula and shoulders are. Another area where we tend to carry tension and stress. How is your upper back and shoulder area right now? The bones, the muscles. Any sensations here? And whatever they are, is it possible to bring an acceptance towards that sensation? Because this is your experience right now, in this moment. And now leaving your shoulder area and bringing your awareness down both your arms, down through your elbows, down to your wrists and out to your hands. And then down through your knuckles and out to your fingers and down to your fingertips. What are you experiencing right now in these hands and fingers? And now moving to the rest of your hands, the inside, the palm, and the back of your hands. What is your experience of your hands? And are you aware of any cold or tension or heat? And now moving up your arms to your elbows. The outside of the elbow, which is hard and bony, and the inside, which is soft. And now moving up to your upper arm. Are you aware of any particular sensations here in the upper arm? And now turning your attention to the shoulders. Any sensations or tightness or tension in the shoulder or neck area. And is it possible to bring a friendly awareness to these areas of your body and accept whatever may be here? And now moving your awareness to the upper torso, the chest area. And beneath the chest wall, the rib cage protecting the lungs and heart. The lungs expanding within the chest wall as you breathe in, and contracting as you breathe out, pressing the air out of the lungs. No effort required to breathe, simply allowing things to be as they are right now, in this present moment. And now gently bringing awareness to the heart area, to its gentle and steady rhythm. Does the heart area feel open or restricted, soft or warm, or hard? Or maybe you are not aware of any sensations here. Whatever you feel or don't feel is to be welcomed, because that's how things are for you right now. And now moving to the neck and the throat area. This small area of our body which carries the weight of our head. Which allows us to swallow food and fluid, as well as allowing the breath to move into our lungs. Are there any sensations here that you are noticing? And now exploring areas around the face, the jaw, the chin, lips, mouth, teeth, tongue, the soft mucous membranes inside your mouth, nose, cheeks, eyes, and behind your eyes, the sockets. Moisture allowing your eyes to move effortlessly. Eyebrows, forehead. Not needing to change anything you find here. Not needing anything to be different. Just being with things as they are. And now moving to the top and the back of your head, exploring the scalp, and beneath the scalp, the skull, protecting the brain area. Now if you want to imagine that at the top of your head there is a blowhole, much like a whale or a dolphin, the size of a coin. And when you are ready, you can imagine breathing in through this opening and allowing the breath to sweep down through your whole body and out through your feet. And then breathing in, allowing the breath to come up through your feet, up through your body, and out through your head. The whole body breathing, much like a wave. The whole body connected. Not separate. Not apart from the outside. Perhaps feeling part of the world. This breathing in and out. And just breathing like this playfully for the next few breaths, if you like to. And now allow the normal breath to return. Perhaps noticing this breath in your chest or your abdomen. Feeling the natural movement in your body. Allowing your feelings and your experience just to be as they are. Awareness of yourself as a whole being. Allowing yourself to be who you are and what you are, with a sense of acceptance and letting be. Reflecting that this in itself is deeply healing. And now returning your awareness to the room you are in. Gently opening your eyes. Beginning to stretch and move your body in any way you feel like. And when you are ready, rolling over to one side before mindfully sitting up